Hello everyone, we have an old patient of us, but she happens to undergo a recent surgery. I say old because she visited the hospital in the month of March last year, and this is her second visit. So she had this swelling near the left nasolabial crease. We can show you other pictures. Yes, so she had this swelling near the left nasolabial crease. Left upper lip is deformed or a little crooked and bent, as we can see, and intraorally along the labial crease, along the buccal crease. So her intraoral picture looked somewhat like this, wherein there was a swelling along the upper lip, a bulge over there, as evidently it's seen, manifesting itself on the exterior, and also the angle of the mouth extending right up to the buccal mucosa. So if we see this, this is how the growth was. Now this growth started as per her statements since birth, but she feels she had a fall in childhood and it's got aggravated post that. This happens to be as we say, a deformity or a disorder which we commonly called as hemangioma. It's not properly a vascular disorder, it's a vascular malformation. So it's a hemangioma in her case, which kept on growing and sits in the orofacial region. The blood vessels or the blood supply over there was tremendous. As we see, it's a high flow lesion, so we can see it's all vascular, it's edematous. Now she did seek treatment for it, but nowhere a surgical treatment was done. It was only conservative. She took injections, and in her own words, injections were taken, which were intralesional injections every 15 days apart. कितने साल लिए आपने वो जो इंजेक्शन था? 1 year लिया, पूरा कंप्लीट किया 1 year. और वो इंजेक्शंस का ड्यूरेशन कितना था? कितने गैप में आपने वो इंजेक्शंस लिए?
पर मंथ
15 डेज़, हर 1 महीने जाते थे. उस इंजेक्शन से कुछ फ़र्क पर आपको लगा? इम्प्रूवमेंट हुआ? साइज़ कम हुआ? आपने इससे पहले कोई भी सर्जरी नहीं करवाई थी कहीं भी? नहीं. She did mention to me that this was the first place which agreed to do a surgical treatment for her, because her hemangioma happened to be of a quite big size and it was intraoral, plus it was reflecting on the exterior. Post the surgery, we'll show you her post-operative pictures, and we have also shared her previous incident, as in the previous surgery and the follow-up priorly. This time she came to us about the external correction and the lip correction. She was not too happy with the lip drooping down. Yes, we do see there is edema. It's because it's just 7 days, 1 week post the surgery, and with hemangiomas and lesions like this, it always takes time. The scar that we see is because the stitches or the sutures are still intact. Some of them are still left in place. That's on purpose because it's a vascular lesion. It takes time to heal, and we are hopeful that the swelling will completely go down. It takes time with as any hemangioma, and she has already experienced it after the first surgery. This time it was more external as compared to priorly, which was more of the intraoral side. Be in touch with us, send us your pictures. She has been in touch with us, and that is the reason she came for the second sitting or the second surgery. We are hopeful that this swelling that we see on the upper lip will also come down. Right now we'll also like to show as to how the intraoral picture is. If you can open your mouth, Kajal, a little bit more. थोड़ा सा ज़्यादा मुँह खोलो, बड़ा मुँह खोलो जितना possible है. So if we see this bulge, as we see the hemangiomatic mass was right there on the upper lip, and also the angle of the mouth. बड़ा मुँह खोलो थोड़ा सा Kajal. Yes, and we see the picture now. Right now, even some surgery has been done inside the mouth, which is just over the upper lip. That is why the swelling, but all the extra bulge, as we note here as well, has been resolved post the first surgery. So this is her after a hemangiomatic resection, not once but twice, one from inside the mouth and one from extraoral, which is outside. And we are hopeful that she will have good results that the patient is desirous of. Thank you.